Council Member. Awesome. All right, so I'm going to pass it over to Council Member John Erickson. Thank you for being here to lead our welcome.
Thank you so much. It's so great to be here with you all, and I'm so thankful for all the work that everyone is doing here. Mental health and all that we need to take and focus on is such an important aspect of my personal life when I think about my day job and then my other job that I seem to do. But we don't take enough time to listen to each other. We don't take enough time to uplift each other, but we're not taking enough time to come together to really work on solutions. I'm really excited that and so happy that NAMI West Side and all of the amazing people I've met through this entire amazing organization invited me back and the city back to come through and join in partnership with this. I'm so amazing that our city offers such critical services, especially during the times of COVID, where isolation and so many things took such a toll on so many of us. So this session is so important. I want to thank Matthew and all the attendees today for what we're going to be doing. And I really am so thankful for the world that we're all trying to build together that's beautiful, creative, and prioritizes both the internal and all the external stuff we need to focus on. So thank you so much. And Matthew, back to you.
Thank you so much, Councilmember Erickson, for all the work that you're doing and for that welcome. And yeah, talking about critical services, I actually want to pass it to Elizabeth Anderson from the city's Strategic Initiatives Division, who's going to lead a presentation on the development of the West Hollywood Care Team, the Behavioral Health Response Team, and their planned connectivity with 988, which is the phone number for Mobile Crisis Response Team. So I'll go ahead and pass it to you.
Great. Good evening, everyone. Thank you so much for the opportunity to share about the great work going on at City of West Hollywood, doing just as you said, working to develop a behavioral health crisis unit, and it is deeply connected with 988. We're calling it the West Hollywood Care Team, and tonight I'm going to be going over the answers to these key questions as we're deep in the development phase for this program. So we'll jump right in. So we are creating a first responder to really help community members who are experiencing a behavioral health crisis. This is going to be in addition to the West Hollywood's law enforcement and life safety services that we're all very familiar with and that are provided with LA County Sheriff's Department and the Fire Department. The care team is going to provide supportive services to help people in crises that are caused by mental health, substance use, and other factors. Services are planned to range from assessment and first aid and non-emergency medical care, substance abuse counseling, welfare checks, resource connection and referrals, support for grief and loss, housing navigation, and even transportation to needed services. The care team is also going to connect to the programs that are funded through the city's existing social service partners. And we're really poised to help all community members, both housed and unhoused, who are experiencing a crisis in the city. And really the shape of the team and the scope of services has been informed by community engagement and community feedback on what our priorities here are in the city and the services that we need in order to meet the needs in the community. Part of that feedback has helped really to prioritize who is going to staff the team. And we're aiming to have a really diverse set of expertise represented in our unit. We're going to have a crisis worker, a medic, a licensed clinician with LPS certification, and also have the team be supported by a case manager. And our goal is really to run the program 24/7. So the next question is, who do I call for services? And how are community members going to access this? And the city, after much research and understanding where the nation, the state, and the region is headed with the power of 988, City Council has selected 988 to move forward as the number to call for help. We are really excited about the intersection of our work because when a community member calls 988, they will have immediate access to the regional crisis support and suicide prevention system before they even are served in person by the West Hollywood Care Team. And we've had conversations with Didi Hirsch, initial conversations just to understand the scope of the work that they do and getting a real sense of their services that are provided 24/7 by crisis counselors. We're really impressed at how they lead with support, compassion, and guidance over the phone, with their goal being to de-escalate and stabilize people during the conversation. And I think what's great about that element is that it means a West Hollywood community member in crisis is going to be able to get help without even having to wait for the arrival of a person on site. And we all know how Los Angeles traffic is, even in West Hollywood, which is only 1.9 square miles. Sometimes it takes a little while to get across the city. So we're so excited about the resources that are built into the 988 system and the opportunity to partner with Didi Hirsch because of their leadership internationally and here locally in the Los Angeles area. We're also really closely tracking the planned partnerships between 911 and 988, which is going to be enabling callers to be triaged out of 911 and into the 988 system to quickly connect with care.
Interesting.
And then next up, I've been talking a lot about the kind of individual level experience, who to call, who's going to arrive on scene, and what services will be provided. But big picture, we really think this program is going to have a lot of impact, even in our relatively small community here in West Hollywood, relative to the size of Los Angeles. We're estimating upwards of 2,500 callers will be helped by the West Hollywood care team on an annual basis. And this estimate's based on the yearly activity in the sheriff's and fire department related to community members in crisis. And really based on the demographics of the West Hollywood community, we're projecting the majority of people served through the program will be housed community members. Creating the West Hollywood care team really represents a paradigm shift in terms of how we're thinking about first responder services. Currently fire and sheriff are the only first responders available to intervene on an immediate basis, and they're really doing so without the best tools to help. Fire and sheriff are almost overextending their expertise to meet the growth in the number of people experiencing behavioral health crises in the community. And by adding the West Hollywood care team, we're really filling that gap and evolving our system so that community members can be served by the first responder with the most expertise to meet their needs. And then lastly, we really want to address the factors that are shaping the timeline to launch the West Hollywood program. Every time we have a chance to talk with the community, the immediate question is, okay, so when does this start? But as many of you know, this is an incredibly complex system. So there's a lot going on in the region that we want to track and partner with so that our program here can be effective and then amplified by the resources that are coming online throughout LA County. So we are closely tracking how we might be able to partner with LA County Alternative Crisis Response Program. We've got 988 going live in July of 2022. We are talking with LA Sheriff's Department and their lead, who is partnering with Didi Hirsch on the collaboration between 911 and 988 to see if there might be opportunities to involve West Hollywood in any pilots they do to advance the communications architecture for triage between 911 into 988. And then we're really looking at ways to establish program funding that can sustain this beyond just city general funds. We're seeking other ways that we can support this work. And then all of those regional pieces coming together is one thing, and then issuing our own RFP for programming and contracting here is also part of the process. So I think all of these things are just something to keep in mind about what it kind of looks like for a city to create its own first responder service that serves our jurisdiction, but is so directly linked with all of these regional resources and systems that are going to be a huge factor in the success of the program. So West Hollywood, is one of 88 cities in LA County, but we're hoping that the work that we're doing here can really potentially be a model also for other smaller cities that are looking to be able to serve their community members with crisis services and to meet needs more effectively. And lastly, we are hosting information and progress on the development of this program at weho.org/strategic initiatives. We've got recorded presentations and staff reports to City Council, and we thank City Council for their leadership and vision in really advancing this work and making our first responder system even more comprehensive and responsive to community needs. So we're just really excited about what the future holds here in the City of West Hollywood and the connectivity with the 988 system and bringing more services to people immediately. Thanks so much.
All right, thank you so much, Elizabeth, for the important work that you're doing. And for anyone who's hearing about 988 for the first time, I'm dropping a link for you all to learn about the Miles Hall Act and kind of like the story behind how 988 was created. Want to make sure that context is there for anyone who's hearing about it for the first time. And yeah, next up, we are excited to invite Ashley McCollum with the Alcott Center, as well as Nick Moriano, the CEO. They're going to be sharing about some of the amazing services that they offer here in our community as well.
Hi, everyone. I'm Nick Moriano. I'm the CEO for the Alcott Center, and I'm here with Ashley. I'm going to tell you a little bit about the services that Alcott offers that would be most relevant here. The Alcott Center has been operating in the Pico Robertson area for 43 years now. We are funded by the LA County Department of Mental Health to serve adults 18 and over who either have Medi-Cal or qualify or who have no health benefits. There's generally no cost to the client. We bill their insurance for the services. We offer comprehensive outpatient services, case management, therapy, both group and individual, psychiatry. We offer right now we're offering in-office services, field services, and we're still doing some telehealth. We will likely continue with those modules moving ahead. We serve about 600 people per year out of our 2 sites on Robertson. And I'm going to let Ashley tell you about our art studio because that's her baby, which she has revived since the COVID pandemic.
Well, yes, I'm very excited to share about the art therapy program. So that's actually in the Pico Robertson neighborhood as well. But the beautiful part about it is that pre-COVID, it was open to the entire community to help reduce the stigma around mental health challenges. And we're getting to a point where we're at least opening up the classes virtually to the rest of the community, in addition to Alcott participants. So it's been a smaller class because of COVID lately, but we offer studio art classes on Thursdays from 10:30 to 12 and creative writing classes on Tuesdays from 3:30 to 4:30. And we are actually partnering with the Department of Public Health now to be able to provide more of those opportunities to community members throughout the West Side. So if anybody would like to join for a creative writing class or a studio arts class, you're more than welcome. And I'm really excited to see the program growing. And we're all of this is possible because of dedicated volunteers from throughout the community that have different kinds of expertise in the arts area, as well as Alcott staff that is dedicated to supporting anybody who needs it during the classes.
And I'd just like to add, if I can, I'm sorry, I didn't know I'd have to speak tonight, so here I am. Our services range from prevention and early intervention through what's called full service partnership. So it's really the full gamut of services. It's the worried well that can come in for short-term services. And it's also people that have more severe mental health challenges, schizophrenia, bipolar disorder, and require longer term. So we really do see the full gamut. The prevention stuff also, we operate a health neighborhood. It's called the Pico Robertson Health Neighborhood. And that's a collaboration of providers. We've been together now 6 years. So we work with people assisting the homeless, Jewish Family Services, LAPD, the Department of Mental Health, Department of Public Health, several other entities. All of you are welcome to attend our meetings. We meet monthly at noon for an hour. And through that, we operate lunch and learns each month as well, which the community is welcome to attend as well. All of this is at no cost. And we really try to gear the lunch and learns towards the health challenges that we see popping up in the community as much as we can. And I'm happy to answer any questions.
Oh, I have a question.
Sure.
So if we are interested in volunteering or helping out, how would we contact you or get involved? And also, is there a minimum age for volunteers? That is my question.
Ashley.
Well, if you would like to get involved, you are welcome to reach out to me. I'll go ahead and put my email in the chat. And our minimum age to volunteer solely, like individually, would be 18, but we have had volunteers that are under 18 come in with parents or guardians.
Okay, thank you. Also, if Elizabeth, who was talking about 988, is still around, I had a question for her, which basically the same question.
Hey, Layla, can you repeat it just one more time?
Oh yeah, is there any way we can get involved with 988, like and also I guess the same question, like what is the minimum age, because I have a brother who's also interested in, like, mental health in that kind of area, and I was just reading up about it, and I've never heard of 988 before this presentation, and I think it's such a great resource that if people knew about it, they would definitely use it. So maybe like helping with like getting the word out, because I saw an article, because when I looked it up, there's an article that said most Americans don't know about it, that it's going to be launched. So maybe we can help with promotion and stuff, at least in the LA area.
Right on. So Didi Hirsch would definitely be the place to Google and check out opportunities to volunteer or support their work, and we can drop their hyperlink into the chat following this. But then I'll just also shout out that even, if you have social media or you're able to share with friends, the idea of just going to the Federal Communications website, their Facebook page, and promoting that, any posts that they have about 988 and just spreading the word is a great way to influence the people that you're close to, beyond getting involved even with 988. So many ways to support, but I think that getting involved that's a great plan.
Okay, thank you. And yes, could you put the link, please? Thank you.
All right, thank you so much, Alcott Center. Thank you, Layla, for that energy. I think that same kind of energy that you have is what brings us all into this room today, to want to use our lived experiences to help start this conversation of how can we bring more appropriate supports and services to our community. And so really excited to kick off our listening session for today. And just to get started, I want to do a little test run with one of our polling tools that we'll be using, because there are lots of voices in the space and we want to give many ways for you to participate. So I'm going to share my screen. And so this tool is called Poll Everywhere. You can join using the device you're on, either by going to pollev.com and entering NAMI WLA, or you can text NAMI WLA, and then this poll should pop up for you. So I'm also going to drop a link that you can use. And then you can just answer this question: what does wellness mean to you? And this will be sort of our test run to make sure people can participate using this tool. And if this tool does not work for you, or if it's too complicated and you're like, Matt, I hate this, I don't want to use it, you can use the chat box as well. And we'll also be able to invite you all to unmute and share your responses. So this is just meant to open up the opportunity to participate. Maybe if you're uncomfortable or a little shy, or maybe if we run out of time on a question and you want to make sure your response is put in, that's what this tool is here for. So I'm gonna give a chance for people to respond to this just to make sure it's working.
Matthew, so the username is Nami
Yes.
West LA. Okay,
Yeah.
thank you.
You can also use that link I put in the chat box. All right, looks like we got people onto it. Wellness means taking care of ourselves and others. Feeling. Yeah, and as these are coming in, if we can invite maybe 2 to 3 of you here at the listening session to share your response out loud. And if you'd like to answer, just go ahead and use the raise hand function or put in the chat that you have an answer and we can call on you. All right, Alicia, yeah, go for it.
Hi, everyone. Trying to figure out my screen, orient myself to Zoom. Grateful to be here with you all. I think I love what everyone has added in the chat so far. I just wanted to add that wellness to me is the experience of feeling whole, feeling in tune, and feeling present, and feeling like a sense of belonging and community. So thank you.
Awesome. Thank you so much for that, Alicia. Also loving all these things coming in the chat. It looks like we're good on this platform. Does anyone have any questions or sort of issues with this style of moderation, like giving you the chance to either unmute and share or being able to use this tool? Just want to make sure we can answer any questions before we dive in. All right, seeing some thumbs up, some nods. Thank you, Erin. See your message in the chat. All right, so we'll keep moving. So this screen that you have on with the poll, you can actually just leave it there on your browser. And every time I go to the next question, you'll automatically be moved to the next question. So however you have this open, just go ahead and leave it there. I'm gonna switch screens for a second and just kind of welcome us into this listening session. So let me present this. I have like 50 tabs open. All right, here we go. So welcome to our NAMI West LA listening session. Just want to share an affirmation as we dive in today, that you are loved, you are not alone, you are seen, you are heard, you are powerful, and you are enough just as you are. And why are we here today? This is a space to listen to you. NAMI West LA and the MHS OAC, or the Mental Health Services Oversight and Accountability Commission, wants to better understand what kind of supports and services we need to be investing in our communities, especially in LA County. We're here to confront challenges. So just talk about some of your specific challenges and needs, both in the past and in the present. But we also want to explore resilience. We want to hear about what's also worked for you. Where can we be moving towards as we think about how to invest in our communities? How can we promote recovery and resilience? So who am I talking and leading the session today? I just want to share a bit about my background. I'm the founder of Cypher. We're a TAY, or transition age youth. That means youth ages 15 to 26. We're a TAY-led nonprofit that uses community-based research and expressive arts to facilitate discussions about mental health and wellness. And our primary art form that we use is dance, hip hop specifically. I'm also the assistant program manager at the California Youth Empowerment Network. They're a TAY-led program of Mental Health America, California. And we help to empower youth to bring their voices to public policy spaces, making sure that our behavioral health system is being designed for youth by youth, in addition to the adults at these decision-making spaces. And finally, I'm a creative consultant, storyteller, and community builder. So I use the arts, strategic planning, and project management to help individuals and organizations find their voice. So that's a little bit about me. I love doing this kind of community building work, and just very excited and honored to share this space with all of you. So thank you for having me today. And just quick background about myself. I have lived experience with psychiatric care, the behavioral health system. I've been in institutionalized care. I am LGBTQ plus myself. And so I can empathize with a lot of the different stories that we may talk about today, how difficult it can be to talk about mental health, mental illness, our interactions with a very flawed system, right? And so as we're opening up this discussion, I want to make sure that you all feel safe, you share what you're comfortable sharing, and to know that we do have support from peer specialists in the room today. So if at any point, maybe you're getting emotionally activated, you're having a hard time processing something you've heard, or you shared something you didn't realize, you thought you were going to share today, and that kind of is bringing some emotions to you. We want you to know that you can reach out to 2 individuals in this room. One of them is Marian Alino, and the other person is Ruby Lake. So they both provide peer services. They help to run the Cal Hope Warm Line, and they're able to support you all today as needed. And Marian and Ruby, would you mind just putting something in the chat so people could see your names real quick?
Yes, will do. Thank you, Matthew.
Awesome. Thank you so much for being here and offering that support. And so as we dive in some community agreements I wanted to share with you all is you don't have to have your cameras turned on. There's no right or wrong answers here, only your lived experiences. All of your experiences are valid. And it's okay that we have different experiences and different opinions. We're not expecting everyone to have the same view on things today. And so if we share different opinions, just do so respectfully and still holding space for the other persons. At some points, I may have to interrupt conversations just to make sure we have a chance to share, or if we're kind of going off topic, I might have to reel it back in. So I just want to make that as a point right now to kind of like set the expectations there. But yeah, does anyone have any community agreements that they have questions on or that they'd like to add to make this a comfortable space to participate? All right then. And if there's anything that comes up for you throughout the listening session, feel free to drop it in the chat like a new community agreement, and I'll make space to acknowledge that and add that to our agreements. So I'm going to stop sharing that and let's dive into the rest of the listening session. So I'm going to open up that poll again, and we're going to move on to our next question. All right. So how do you or your loved ones achieve wellness? All of you just shared these beautiful definitions of what wellness means to you or looks like for you. So how do you or your loved ones achieve wellness? This can be maybe from your typical mental health resources, and they could be atypical. Maybe they're more just things that you have in your life that you use that have been helpful for you. So I don't want you to feel like you can only like share like a clinical resource, just any way that you feel you or your loved ones achieve wellness in your community. And again, I invite you to answer through this poll, as well as you can raise your hand and unmute and share. Right, hiking, meditating, swimming in the ocean, spending undistracted time together, maintaining physical health and staying active, being part of our community, quality time with trusted loved ones and friends. I'm seeing a lot of answers about this sense of like connecting and spending time with others. Sleep, laughing, dance, rest. Yeah, does anyone want to unmute and share? Just want to hold space for that. And it's okay if no one does. I'm not going to sit here and wait until someone does that. Right. Yeah, I see a lot of things around connecting, around physical health, being in nature, big theme, seeking support from professionals and friends. We love to see that balance. Taking time to do the things that you're passionate about. All right, love these answers. Thank you for these. We're gonna move on to the next question. All right. So when you hear the words mental health, what words or emotions does that bring up? And for this one, keep your response to one word because it's going to be a word cloud. So one word or a feeling or emotion that this word brings up. And again, if anyone wants to unmute and share, totally feel free to do so and elaborate. It's so interesting, the range. So some of these words get bigger. And so if you see a word bigger, that means more if you sent that word in. But it looks like there's such a big range in what this word is bringing to us that the letters are all staying about the same size. Okay, support, we're seeing some more responses on that. I see misunderstood, stigma, fragile. Yeah, can anyone unmute and maybe elaborate on a word that they shared here? Doesn't matter what word you picked.
Hey, Matthew, it's Tim here. I shared gratitude because when I hear the words mental health being spoken, it means people are having conversations about mental health. And to me, that's a huge, step in the right direction to be having these conversations and normalizing the conversations about it.
Absolutely. Thank you, Tim. I love that word, gratitude.
Well, I put empathy because I think mental health requires a lot of I think that people talk about the difference between sympathy and empathy. So I feel like mental health really needs like going beyond that surface level of like, oh, like trying to like of just like, oh yeah, I feel bad for you, or like, oh, it must be hard, and just like getting to the root of it. That's like really trying to understand someone and the not just the struggles but also like the successes that they have, because I feel like oftentimes it's all about the struggling, which there are struggles, but it's not helpful to just like focus on the struggles all the time. And then that's why I also put listening, because I think listening is the only way you can really understand what someone's going through.
And I really love the word understanding. You know, when people have mental health challenges, if they feel understood and seen by their relatives, by a good friend, by, a professional or a support group, they sometimes have more courage to change and work on themselves. It's so important that we see each other and hear each other and thereby understand each other and validate each other. So I love the word understanding.
Thank you so much, Sharon. Thank you, Layla. I see some common themes here: listening, understanding, moving beyond sympathy or kind of like almost like pity to really like connecting and understanding one another. I love those. Let's move on to the next question. Thank you all for these amazing responses. So on the flip side, when we hear the word mental illness, curious what words or emotions does this bring up for you?
Sad.
Sad. Do you want to elaborate on that a little, Sharon?
Well, I mean.
Oh, Sharon, I think you accidentally muted.
You know, when mental illness kidnaps the brain of a family, it kidnaps the entire family into a maelstream of chaos, despair, confusion, fear. You know, it is in a sense a family catastrophe when mental illness kidnaps the brain of a family member. And so, so I think it brings up fear and worry and anxiety when we talk about mental illness.
Just last question for you, Sharon. Is there a particular maybe condition that you're thinking about when you're bringing this up?
Well, not really. I mean, I think of an individual who has thoughts that are not relating to reality. You know, they're in psychosis, they're being manic and doing strange and somewhat dangerous things and spending all their money and stealing from the parents' bank accounts. And, you know, so there's a lot of mental health conditions, mental illness conditions that are very troubling and disturbing for the entire family. The neighbors, just had a manager of a building talk about there was a mentally ill psychotic renter in the building. And my God, the whole building got really emotionally upset, didn't know what to do.
Yeah,
So,
I hear a lot of the hardship, some of the confusion, the fear that you've experienced, and just want to hold space for that. And thank you for sharing. Yeah. Seeing a lot of other feelings and words that are coming up for people. We see protecting, we see stress, we see helpless, see a lot of tough feelings and words here. Is there anyone else maybe who hasn't spoken yet that wants to share a little bit about what they put here? Again, there's no right or wrong answers, just want to hear a little bit more.
I'll share a little bit, Matthew. I
Please.
think that I think the word illness, sometimes there's a lot more stigma surrounding the word illness versus condition. Condition seems like it's very manageable. You know, you would say, you know, my mother has a heart condition, so she takes medication to manage her heart condition. And it seems manageable and something very easy to talk about. When the word illness comes up, it almost has this, like Sharon was saying, this fear, this anxiety. It almost sounds like a word from the 1800s or something, like they have an illness. And it's like this, almost this stigma that surrounds that word, there's fear surrounding it, that it's not as manageable. And I don't necessarily know if I would say my mother has a heart illness. It just doesn't seem like it would fit. So I think condition, it even kind of sounds like, you know, we do physical conditioning. So it's something that you can work on and improve. So I think that the word illness for me really brings up some stigma.
yeah, like mental health challenges is so much easier to hear than mental illness.
And I'm going to pass it over to Nick. I see your hand is up, and we'll move on to the next question after this.
Yeah, I put negativity for the same reasons that the last two people were saying. Illness just implies negativity. And actually, our mission statement up until a few years ago stated that we help people with mental illness. We changed that to mental health challenges because it sounds more hopeful. And I don't know anybody who hasn't had a mental health challenge. So it feels better to say that. I do agree the illness, that word just, it feels very negative and old.
All right, thank you so much for all of your feedback. It's really interesting, the power of language and what it could do. And at the same time, really just thankful for the space to like unpack that in the word mental health, mental illness. The reason we wanted to ask that is because, you know, these words are used so interchangeably sometimes too. And so just want to, in case this is helpful for anyone, just share these slides real quick. Mental health, when we use that word, you can think about it as including our, sorry, if someone can make sure they're muted, but includes how our emotional, psychological, and social well-being, it affects how we think, feel, and act. Also helps determine how we handle stress, relate to others, and make choices. It's important at every stage of life, from childhood to adolescence to adulthood. So we can kind of think about this like our physical health, right? Sometimes when people say mental health, they're trying to talk about mental health condition or mental illness. We have mental health just like we have physical health. It's a part of us that we can continue to build up and promote. And it's a very positive thing to talk about. And so mental illness and or mental health condition, just like Erin was saying, that she uses interchangeably or actually prefers mental health condition. This is actually from NAMI's website. It's a condition that affects a person's thinking, feeling, behavior, or mood. They can deeply impact day-to-day living and can also affect the ability to relate to others. But the thing about mental health conditions is they can vary so widely too, depending on the condition and how they impact us. So it's not enough to just say like the word mental illness or mental health condition. Sometimes it's a lot more helpful for us to name the condition so we can add a little bit more context and take away from that stigma a little. So for example, naming things like anxiety or depression or bipolar or schizophrenia, giving names to these conditions can help us remove that stigma and be a little bit more objective with what we're talking about. So I just wanted to share these two sort of key terms before we move on for today. But let me jump back over to our poll. Oops. Okay. Do we see the poll? Just want to double check. All right. So next question that we have is, on a scale of 1 to 10, with 1 being very unsupported and 10 being very strongly supported, how much support do you feel like your community provides for individuals living with a mental health condition? And with your number, if you want to type in a little bit of your reasoning as to why, if you want to hone in on a specific condition, like maybe it's like 1, my cousin lives with schizophrenia, but has received very, very few, culturally competent services because she's Vietnamese. She has a hard time receiving support. So there's an example of an answer you could share, but would love to see your number and kind of your reasoning behind that. And again, inviting all of you to be able to unmute and share. And especially for anyone who hasn't shared yet, feel free to take the floor first.
This is not sharing, but maybe you need to refresh the page because I think people have put in answers, but they're not coming up.
Thank you, Layla.
Also, Matthew, can you put the, Marion gave it to me, but I can't seem to bring it up, the poll. I lost it.
Oh yeah, sure. So you can, here's the instructions to jump on, sharing on my screen. And then let me paste the link for you again. Okay, I'm seeing 6, 5s, 3, 2, not enough support after hospitalization. I think someone's entering the code there. We're making progress, but have a long way to go in terms of access and equity. 1 or 10, because it all depends on the financial resource available. So depending on, if you have the financial means, maybe it does feel like a 10. Okay. 2, it's mental health is not well understood and therefore hard for others to know how to help. Depending on finances. Yeah, does anyone want to kind of unmute and share a little bit their thoughts on this?
Well, I think that there's a dearth of mental health treatment that's available to all of the individuals with a diagnosis. We don't have enough psychiatrists, we don't have enough mental health clinics, we surely don't have enough hospitals, we don't have enough mental health residential treatment places that are affordable. I mean, the mentally ill are left on the dung heap of life to rot in our streets being homeless because loving parents and family members finally give up because they can't find adequate treatment. It's such a tragedy. I mean, in comparison to Western European countries and how they help the mentally ill. America is a tragedy. And I'm sorry to be so negative, but I've been president of NAMI for many, many years, and I've had years and years of experience, and this sums up my true experience.
Sure, no need to apologize for being quote unquote negative. This listening session is a space to hear out everyone's thoughts and experiences, so thank you. And there's some names in the chat I just want to call on to invite you into chat. Don't feel pressured to, but we'd love to hear from you. I see Cynthia, Jason, Jelos, Kiona, Angelica, Corey. And if I didn't call on your name, but you haven't shared yet, please would love to hear from you.
I've already spoken, but I can share. Personally, from my experience of having ADHD, getting a diagnosis for that was probably one of the hardest things that I've done in my life, just because, first of all, the way you present is very important, because if you don't present in a way people assume or associate with a certain mental conditions, you either won't be believed or listened to, or it'll be very difficult to get a diagnosis because they think like you just can't have it just because of the way you present, even though you might have the same struggles and need the same treatment. And the process was not very friendly to me. I was like struggling to just fill out the forms, because there are just so many forms and documents you need to provide them, and it's like you're just trying to justify like why you need this, and it only gets harder when you're an adult. I know other adults currently. One person I know thinks that he may be on the autism spectrum, but he doesn't have the hope or the courage to seek out treatment, because he knows finding a diagnosis at that point would just be too difficult. So I think having resources not be dependent on workplace or schools would be really great, and just having them be based on like I know, just like the community you live in, but and also not having too much difference in the types of resources in different communities, because like I know that's what happens with the school system. People want to move to better places in order to go to better schools, because the schools in low income areas are not as well resourced as ones in higher income areas. So I think that's also very important.
Thank you so much, Layla, for all of that.
I just wanted to say that that's what feels so unfair, is that there is so much support, but it just depends on what money you have and how it's not available unless you do. But the hospitals, like, and I'd love to hear from Sunny in that, they're probably feel very overwhelmed, but they are very kind and wonderful at hospitals. And I always have found it incredibly, that's not where we found out about NAMI, Westside LA. NAMI, which is, I don't, at some point somebody will, Erin will talk about what NAMI is, because I don't know that everybody else here knows it, but it is a community and family. And I have a son who has bipolar. And actually the most sort of unkind psychiatrist that he went to gave me the pamphlet for NAMI. So that was interesting. And because I think they do feel, I think professional, I don't know, maybe they feel they can't really handle it. It's going to have to take a whole other, like this, like NAMI, like community, like Layla, like Sharon, like all these people that are just like out on the street changing things, not through what we think, and also what cities like West Hollywood is actually trying to be a supportive place. And a lot of it is talked about. I live in Santa Monica, and they talk about having these, all these group, the van, all this thing. And I've called many times. I have a family in my building, family down the street, because now people call me all the time when they need help. And I try to call, and they say, oh, they don't work on weekends. They can't come out. They're not going to do it, And so I just hope that actually what we're all talking about actually happens, and it starts to happen soon, because as we know, it's out of control. And the people that I see in the street, I know have families, because I know them in our support groups, and they just don't know what more they can do. So I want to hear from others about that.
I would just like to add to both what Gigi and Leela said about how like a lot of these areas don't have access to the like support as much as other areas do. But also I feel like, and I also wanted to add that I feel like a lot of places like will talk about, mental health, and they'll say it's important, and like we hear a lot about it, like, take care of yourself, self-care. But when it comes down to like the actual resources and like implementing it, it seems like there's like a very large disconnect, partially because there isn't enough funding for it. But also I think it's just people aren't like, the resources are like not as accessible, or like people aren't aware of them.
Yep, so many big themes that you're all touching on, and seeing some agreement in the chat as well. And Cynthia, I see your hand.
Hi, I'm Cynthia Sirota, and I work for CalHelp in NAMI West Side as well. And I answer the phone, and I'm hearing so much heartache from these parents that care so much for their loved ones. You cannot believe it. It's just the kids are in psychosis. They don't want to take medication. They're closing down board and cares. There's not enough places for these people to live in. And the parents just don't know what to do. Then they get arrested or they go in jail. It's such a vicious cycle, and nobody's really there to help. They're suffering. Their hands are tied behind their back. I get very emotional at this, and it's really hard. No one's sitting down and really talking to these parents. They're taking them on a 2-day hold, letting their kids go out with a prescription. They don't fill the prescription. Nobody's following these people. And it's just a routine of routine and routine. Marijuana is really hurting all the mental illness. It's causing schizophrenia. Their people are having psychosis. There's so much that really needs to be done. And if you have money, it seems that you could spend $40,000 a month and have your child get well. But if you don't have money, if you don't have insurance, where do they go? How can we help?
Yeah, I just want to add a little bit more subtlety to that. With marijuana use, definitely there are links and risk factors with experiencing psychosis and triggering schizophrenia. Just want to be careful not to say cause, but there's
Okay,
definitely
you're right.
those
Matthew,
risk
you're
factors,
right.
absolutely. And that is very important research to be talking about. Thank you for uplifting that. Hearing so many things about, access being dependent on financial situation, on what your city or community is able to provide, hearing stories about inpatient care, psychiatric facilities, the need to support parents, the need to support community members to even know what's available, to reduce stigma so people even want to access resources that do exist. There's so much to do, and there's so much opportunity. So thank you all for sharing all of these things. This all being recorded. Your responses here in the poll are all being saved as well. And again, just want to encourage all of you for sharing this, because this will go directly to inform the MHS OAC with all of your responses. So thank you so much, everyone, for sharing. I'm going to go ahead and move on to the next question. This conversation is just going to keep moving forward, keep continuing. So we're not just moving on and forgetting this. So we want to ask for all of you, we're talking about some of the challenges that we're having, and I'm curious, what is recovery? What does that look like or mean to you when you hear that word? And let's take just a second to let people load up some responses, and then I'll invite others to share, unmute. And if you've shared already in this space, please just give a second to see if there's anyone new that wants to share first. And then if no one is speaking up or sharing, yeah, definitely feel free to jump in.
Hello. Hi, Matthew.
Yes.
Hi.
Please.
Hi, can you hear me?
Yes, yes.
Hi, I'm a nurse from UCLA, and I just wanted to say, to me, recovery is just returning to a normal state of health. Just like I'm not expecting for somebody to be like more than what they were, but just to get back to the normal state of health. Be normalized the way they were before. So it's pretty much taking baby steps to get back right. because everybody, you notice that a lot of times, like our patients, especially the ones that are have like before the breakdowns or whatever happened, they want to go back to being, they're in a hospital and they want to go back to going to like executives and they want to go back to their jobs. And we tell them, hey, take baby steps, take a break, they want to go back to college. And, because a lot of times they have breaks, and then they're in the middle of college, first breaks, and then they come into the hospital. And then so when they get ready to go home, they're like, I want to go back to school right away. So I think it's just, getting back to that normal state of mind, taking baby steps and breathing before, to me, that's what recovery is.
Thank you so much. And I think it's Era.
Yes.
Thanks so much, Era.
You're welcome.
Right, seeing some of these answers: balance, resilience, sustainable plan with the loved and trusted community. It includes relapses and remissions. Acceptance. Okay, and I see in the chat, patience, I see healing. Grace. Yeah, is there maybe one more person that would like to share before we move on to the next question, especially if you haven't been able to participate yet?
Matthew, I've participated already, but I just wanted to say that I think recovery is not linear. And that sometimes we think of it as a destination or a finish line. And seeing all of these responses, I think we've all probably had lived experience with that. But I think it should be noted that it is not a linear process.
Yeah, a metaphor a therapist told me one time is like, I felt like I kept coming back to the same place, with my depression. And she gave me this metaphor or now whatever the right word is, that it can feel like we're coming back in this circle in the same place, but actually we're like constantly moving upward through this new journey, right? So even though it feels like you're here, you're back in this similar spot, but you're up here now, because life is always moving forward. And so yeah, I really love that. I connect with you a lot on that, Erin. That's not necessarily linear.
And I know that recovery includes spiritual growth. I think spiritual growth is always a part of recovery, with the person with the illness and all the family members too. It causes humility and spiritual growth and increased compassion and kindness.
Love that. Thank you, Sharon. All right. Yeah, some about spirituality. I feel that a lot. Our next, we're actually going to skip this question right now. Oh, wait, actually, no, we're not skipping this question. So on this line of recovery, we talked about what we're lacking in our community in the previous question as well. So what kinds of support do you feel like you need to cope and thrive with your mental health condition? Or do you feel like a loved one in your life needs? So let's take a second and answer this poll, and then would love to hear some of you unmute and share. If you were saying 2 or 3 or even 6 or 7, like what's missing, what's needed? Or maybe there's something that you're using or that a loved one's using that's working so well that you want to share here as well. Oof, affordable therapy. I feel that. Therapy with a trusted therapist. For whoever put therapy with a trusted therapist, can I ask you what would make them feel trusted?
Hi, Matthew, that was me. Well, you have to build trust, and that can be hard and can take some time, but the best therapy relationships that I've experienced have been worth putting in the time. And it's also good to learn when you don't have a connection. I mean, our son has had a little difficulty connecting with a therapist at college, but he's learned like he doesn't just have to say yes to everyone. And he has, fortunately, he has a therapist back here in Los Angeles that he really does love and trust. Hasn't been able to find that as easily in Boston. So yeah, I mean, it takes time, and that's also one of the difficulties about mental health recovery is that there's no easy fix, and that's why it's so important to have the support and love of a family and a community, which I do love that NAMI does so well in kind of activating.
Thank you, Tim. I see how to create a balanced schedule, work leisure in order to not burn out. I see for recovery, harm reduction program. See follow-up care, conflict resolution skills. How to recognize abuse, how to leave a relationship you're unhappy with. Easy to access support groups, maybe at night or after work that can be accessed via Zoom. Yeah, does anyone else want to elaborate on something they put here?
Hi, Matthew. I'm Sunny. I'm also from UCLA. I mean, being in the hospital obviously is not enough. There's so much to do, so much work to do right after the hospitalization. Being in the hospital is just the initial thing. And unfortunately, it's so hard for us, to find support for the patients that are being discharged. I mean, thankfully, we don't discharge our patients until they have a proper follow-up, like with a therapist, psychiatrist, or aftercare program with partial hospitalization. We make sure that those are set up first. But sometimes, actually, most of the time, a patient needs more than that. They need support from their family, they need support from the community. And even though some of those supports are available, especially, NAMI West Side, it's also the, their motivation or family helping them, making sure that they get those support. And for now, I think the biggest challenge for us, and Era can back me up on this, is the hardest one for us to get support for are patients with autism, especially with adults. There's not a lot of places for them to go, and parents are really burnt out, getting hurt. That's why their family member ends up with us, because parents or siblings are getting hurt at home. And so a lot of them, they don't want to take their family member back, because the one with the mental health condition is getting worse with their aggressive behavior. So unfortunately, with autism, it's not just medication management, it's a lot of behavioral management. And not a lot of places really are equipped with some type of behavioral management. I mean, even for us, we have actually just recently hired a behaviorist to help with this type of patients. And she's only one person, and it's not enough. So there's a lot of research going on with UCLA to take care of this type of patients, but still it's where do they go after being with us? And unfortunately, they stay with us for like months and months at a time before they can even find a place. So it's a struggle.
Such a struggle.
Thank you so much, Sunny, for sharing that.
Yes.
You're welcome.
Nice to see you, Sunny.
Yeah, Izzy, I don't know if you're able to contribute. I just want to invite you into the chat, or Jason or Angelica. And it's okay if you're like, nope, like I'm not trying to unmute, but just want to make sure your voices are heard. You have that space to contribute.
I'll go. It's me, Izzy. Hi.
Yeah.
I think the support that is important. I kind of wrote about it in the chat. I put consistency. For me, as a former foster youth, I didn't have a lot of consistency. I moved more than 16 times before I turned 21, so consistency is important to me, and patience and openness. I feel like without those things, it's hard for me to thrive, because it's hard for me to get to know people, especially in therapy, and to trust in therapy. So I usually need patience and like understanding that like I have a lot of trauma and it's hard for me to open up. So it may be like minimal things that I'm talking about until I'm ready to really open up.
Thank you.
Thank you so much, Izzy. All right, so let's go ahead and move on to the next question. So for this one, I'm actually gonna pop up, oops, didn't mean to mute. I'm gonna pop up my slides again real quick to share some just like basic definitions of the next things that we're gonna be talking about. So something we talk a lot about is the need for prevention and early intervention services. And do we see my slide up with this pink flower here? Yeah, okay, cool. So when we talk about prevention, this is not like an all-encompassing definition, but you can think about it as an important approach to improving mental health. It means trying to stop issues from developing, getting worse, or coming back. So there's primary, secondary, and tertiary prevention if you want to get really jargony, but essentially this is like a more simple way we could talk about it. So some examples, it could be like an anti-stigma campaign for Mental Health Awareness Week. This is like generalized to the whole community. Or if you want to look at a community that might be at risk for secondary prevention, maybe you work with LGBTQ youth at the school who have been bullied and have reported bullying. So they are at risk. They're an at-risk population because of that. So there's some programs that can be targeted specifically to empower them to get involved with shaping the policy at their school or working with their school board. Or there could be, for example, if someone was living with a substance use disorder, maybe they've gone through a program already to manage their addiction, but afterwards there's like, for example, there's a music support group in LA that's aimed at reducing a person's risk of relapse by bringing them into a community space, giving them the tools to express themselves and connect and be in a healthy community. So these are some examples of prevention that exist here in LA. And when we hear early intervention, this is a process of providing specialist intervention and support to a person who's experiencing or demonstrating any of the early symptoms of a mental health condition or mental illness. So some examples of early interventions can be cognitive behavioral therapy, mindfulness meditation practices, psychoeducation, which is like providing education on maybe the condition that someone is living with so they can understand it better, along with like being in therapy. So these are just some examples of prevention and early intervention, just to kind of help in case like you're hearing those words for the first time, or you've heard them a lot, but you're not quite sure what they're touching on. So before we open up the poll, just wanted to share that. But we're gonna jump back to the poll. So what types of prevention or early intervention services are you aware of that are available in your community? Or if you're like, I'm not aware of any right now, that's also a valid answer. And just want to get a sense of like, are you familiar with any of these things? Have you seen them? Maybe you've utilized them or a loved one has utilized them. This question is kind of get a sense of that. Multilingual mental health resources, that's awesome. And for whoever shared that, if you can add in what types of resources specifically, that'd be really great. Or you can unmute.
Oh, I shared it because
Yeah.
I think that a lot of, because I live in an area that has a lot of Asian people, specifically Chinese people, and also a large Hispanic community. So we always have all of our signs and resources in Chinese and Spanish at the very least. Sometimes there's also Vietnamese, which I think is also a good thing because there are other Asian languages out there. But yeah, like we have ones for like helping you fill out your taxes. We have ones for helping you apply for passports, which is really nice, I think. And then we also have ones about like mental health resources, like telling parents about, like, especially immigrant parents, they come from different countries and cultures, so they might not know what anxiety is or what depression is, and that, you know, it's serious and their child might need to seek treatment for it. So we have pamphlets like explaining that, and also how to apply for some insurances / financial aid.
And this is through where are these
So
pamphlets?
this is in our city hall and some high schools in the area that I've seen.
Great, thank you, Layla. All right, seeing Nami West LA ending the silence presentations, couple of folks naming that, youth groups, California First Five, Alcott Center services that they mentioned earlier as well. And just clicking here because it wasn't showing the full answer. Awesome. Knowledge about most common mental health challenges. And I see in the chat, rise family therapy with parents before adoption if possible. I love that. Yeah, would anyone else like to share before I move on? Just want to make sure I'm not moving too quickly.
I'll go.
Yeah, Izzy.
I put rise, and then I also put the adoption, the family therapy before adoption. Just because I think being able to talk out what's going on with the family before even putting the kid up for adoption is very important. Because it gives it a chance, and I think that the child, if they do have to be put up for adoption because something happens, the child may understand a little more, especially if they're older. Like, okay, we try to talk about it, and it just maybe didn't go through the way I planned it to, but they may understand when they're older, if that makes sense. And then also with Rise, Rise is a wraparound team for Los Angeles County with LGBTQ youth at the Los Angeles LGBT Center. So I feel like usually they work with former foster youth or foster youth. Well, right now it's former foster youth. It's now to 26. They just updated their program, but they work as a wraparound team for youth and foster care for LGBTQ youth.
That's amazing. Thank you, Izzy. Yeah, and I see something in the chat. Can we have all these emailed to us, please? So these poll responses I will be sharing with NAMI West LA, and I'm not sure how those can be shared. So that'll be a question with NAMI West LA leadership. Yeah. Also, all of your responses are going to be and they're going to be made anonymous, so your names won't be attached to each of these responses either.
Oh yeah, sorry for the interruption earlier. But I'd also like to, since we're talking about resources that how the quality varies based on your financial situation, I would like to draw attention to I believe it is a free resource, the Asian American Dispute Resolution Center, or any mediation centers in general. There are a lot of free ones or low cost ones. I know because I work at a law firm, and when we have local income clients, we refer them to here because it's they help with conflict resolution and stuff, so that instead of spending a lot of time, I think they do it for non-legal issues too maybe, but yeah, if you need someone a third party to help with conflict resolution or to help discuss things, I think that they also do it.
Thank you, Layla. And if you want to list that resource in the chat, that'd be helpful too. I'm going to move us into the next question. So with all these services that have been named, have you or a loved one utilized these services? And if so, how was their experience with that? Or how was your experience with that? So let me activate this. So essentially, if you have utilized any of these services, what was yours or a loved one's experience with it? Sorry, I know the wording on the poll here is a little confusing. I'll also type that. I'll retype what I just said in the chat. Okay, seeing Nami. My children have a better vocabulary and gain more confidence to discuss their mental health. I'm assuming, is that with NAMI or whoever shared that? If you want to share what resource that came with. When they actually have the courage to utilize services, they're great, but they're filled with stigma so often that they don't participate. Good. I was able to utilize resources, connect with older generations of my family, and tell them about the support and help I needed. So for this one, what resource are you referring to? Being able to connect with
It's me. I was referring to the pamphlets and like kind of like the multilingual resources, because like my grandma, she doesn't, she's an immigrant, she comes from Indonesia / China, so she does not understand sometimes that the things she does might trigger me. And so then I was able to tell her like, please don't do this because of, you know, this reason, and I think it really helped.
That's awesome. Seeing a lot of NAMI. Great to see all the ETS youth presenters leading the way by talking honestly and openly about their conditions while helping themselves and the students they're talking to in the process. Again, ETS is a presentation with NAMI called Ending the Silence. Suicide Prevention Hotline. Whoever shared that, would you be comfortable sharing, was that a helpful resource? Like, was your experience or your loved one's experience with that helpful? And I see in the chat Trans Lifeline. Izzy, if you want to share about that as well, would love to open the floor for you.
Yeah, I can speak. I've called the Trans Lifeline before, just when I was going through a lot, and I called them recently actually, and they really just support and kind of, you really don't even have to tell them your name. Like, they don't ask for much information. They kind of just talk to you and let you know like things are okay, and they'll talk you through whatever you're going through. At first I didn't always like doing it because it's hard for me to like, I kind of have to hash up things that come up. I have to hash things that come up due to like my past trauma, and then to talk about what's currently happening. So it's kind of hard, but it is a helpful like resource when it's really needed, and just good to talk to someone.
That's amazing. Thank you, Izzy. Right. Adoption support groups through our FFA. Yeah, Cynthia.
Hi, my mom is Cynthia and she's making dinner, so I'm a Cal Hope NAMI Westside LA crisis counselor, and sometimes I speak for NAMI Westside LA too. And I wanted to say that I've been in the hospital about 26 times, and the last hospital was the best. I went to UCLA and they kept me for a very long time. They're very kind. I had my own room. I had, I think, a TV in my room. They had activities throughout the day. I think they had really good tuna fish sandwiches, I remember. But the truth was that UCLA was really helpful to me, and I wanted to make sure I recognize them. Thank you.
Thanks so much for sharing that. Yeah, those are all just, they seem like such small things to be able to have, but can make such a big impact, you know, when we're there in our stays. Really appreciate that. Seeing some love in the chat. All right, let's move on to the next question. So what have been your challenges in accessing mental health care for yourself or for a loved one? So I know we touched on some of this already around like having financial means to access, or maybe there's language barriers. So can you use this space to maybe elaborate more on that? For example, if you're saying like financial difficulties, let us know how expensive something was, or what language difficulties, like what language were they lacking, you know? Just want to encourage us to give a bit more detail in this one. See, getting started. If whoever shared that is comfortable, I'd love to hear what you mean by getting started.
Hi, Elizabeth here. I shared the getting started one, just not so much about a systemic barrier, but more on the internal challenge of getting started and the tipping point for saying, okay, I'm ready to go get help.
That's really big. And then like with all the the hardship or the challenge that comes with getting to that point, it's like we try to access these services and then it's already it's so hard, right? I think it goes hand in hand with like, how do we support people with feeling empowered to recognize like, oh, I can use some support and I'm ready to do that. And also improving the systems around us so that when we finally are able to get to that point, support's easily available.
Yeah, it's
Can I
like
go? Oh,
Go ahead. I think I saw Izzy's chat box and then who was the other person?
me,
the other
Nick.
person could go first.
Okay.
Okay. I just wanted to piggyback on what Elizabeth said. It's hard to get started. And then once you get started, you run into so many barriers, both in the public system and the private system. Long wait lists, not enough therapists available on the health plan, people no longer taking clients. And then I think it gets very frustrating and people give up. I myself have fell into that several times. And then going out of pocket is obviously very pricey. So it's about getting started. And then it's also about following through or having the energy to follow through if you're suffering from depression or something else.
Thank you, Nick. And Izzy?
Yeah, mine was kind of long to write, so I wasn't able to write it. But I wanted to say one of the challenges is again with like the consistency. I feel that with me, I was after being in foster care for 21 years, I was homeless for 3 years after an internship that didn't pay me. And so having to move from shelter to shelter was really hard because with the shelters and then trying to access like mental health, I was moving around to different cities here in LA. And so it would be harder and harder to get to wherever I had signed up to. So I would have to start over and start new assessments. And then I had to wait until they realized how bad my mental health really was to even get like an FSP team or even more intensive care before even going into crisis or trying to go, like having to go to the hospital. So it was really difficult trying to navigate that because by the time I was seeking resources, I was already in crisis. I was homeless. And I had came out of the foster care system. So I feel like there should have been a lot more of a stable transition with me transferring out of foster care and into adulthood and with therapy and everything. I don't think there's a good enough transition for youth in foster care.
Thank you so much, Izzy. Really appreciate you sharing that. Ashley, I see your hand.
Yeah, I just wanted to add to this conversation. In my experience supporting a friend finding a therapist that she actually wanted to talk to, it was really difficult to find somebody who was representative of her positionality and like who she felt comfortable sharing her life with. And I think, you know, that's something that to me has definitely been a challenge in terms of being able to access mental health care that's actually meeting the person where they're at in terms of who would be the most beneficial for them to talk to too.
Can I also add one more thing?
Sure, yeah.
Also, I was going to say, sorry, I lost my train of thought. Hold on, let me get it really quick.
All good, all good.
Sorry, I'll come back. Sorry.
Sure thing. Is there one other person that would like to unmute and share, and then I'll bring it back to Izzy, and then we'll go to the next question.
I remembered.
Go for it, Izzy.
I feel like with being homeless, like the vulnerability, because I had to kind of put all my cards on the, like everything on the table and be like, this is how I'm feeling. This is exactly what's going on. And like, like I said, I was already in crisis, so I had to be completely vulnerable, and that's really hard for me because I'm not usually talking to people. I don't always talk to people. I'm really introverted myself. So to have to just put everything out on the table and like I would break down in tears. Like it just wasn't healthy to like have to like we come up with that. Like we talk about everything and having to go through assessment after assessment after assessment to get mental health services.
I hear you. I hear you on that one. Thank you so much for sharing. All right, let's move on to the next question and kind of like, honoring what you're just sharing, Izzy. We want to use this question as a space to be like, okay, like with these challenges that you face and you've had, either you're going through them or you went through them in the past, like what do you think needs to change to improve access? What are the solutions that you have in mind or that you've seen already? We want to open the space to kind of hear your feedback on that. What do you think can improve access to mental health care for individuals?
I think one way I think is in foster care we are also told to be in therapy at a really young age usually. Usually it is quite mandated to be in therapy. But I think talking about the importance of therapy with youth and letting them know why it's important. So they're not just going and not utilizing it the way they can, because they're not understanding it or they're not wanting to do it because they don't understand the full impact it can have and how it can be so beneficial for you. I feel like for so long I didn't utilize the therapy that I could until I was like maybe 15, 16, 17. Then I really was like, okay, like I really need this. And now sometimes I do therapy 3 days a week. Like I'm still really doing a lot of therapy sometimes.
Yeah, making the space and time to really inform people about these services. Elizabeth, I think I saw your hand. Yeah.
I was going to jump in with a comment on the kind of supply side of not enough mental health staffing at all levels and different expertise and training from lived peer experience to clinicians. I know that what was really influential for me when I was going through MSW school was getting a stipend through the Department of Mental Health that helped pay for costs for education, but then required a commitment after to work in a nonprofit agency that had a DMH contract, and that directly influenced my career trajectory. And I think helping with educational costs to get the sector staffed up would be a huge way to help people improve access to mental health services.
Yeah, that's huge. And there's a bill out right now. I don't know the number off the top of my head, that is supposed to try to bring 10,000 clinicians into schools and community settings by a very similar approach, committing 2 years to either CBO or a school in an underserved community once they finish their hours. Yeah, I love that. Seeing Angelica, UCLA has a mobile mental unit team that goes out to help patients that are homeless and or in shelters with mental conditions. That's awesome. Is there a name for that team, Angelica? Or is that the name maybe? Okay. I see social media campaign to educate the general public, to educate on basic mental health, utilize more psychiatric nurse practitioners, more funding allocation for mental health care. Yeah, a lot of these answers, I just see this common thread of like really building up our workforce, our capacity to serve people in our community. I'm also seeing things around stigma, being able to normalize some of these resources. Okay, thank you, Angelica. That's still helpful. Yeah, is there maybe one more person that wants to unmute and share before we go to the next one? And no pressure, just want to make sure I open the floor for that. All right, let's move on to the next question then. Okay, so this one, I'm gonna share another slide. So do you feel like you or your loved ones have access to culturally competent supports and services? So to kind of give an example, let me switch over here. Oops. So cultural competence, there's a lot of definitions, but refers to being aware of your own cultural beliefs and values and how these may be different from other cultures, including being able to learn about and honor the different cultures of those you work with. And there's another term, cultural humility, which is kind of a term to recognize this is an ongoing process. We're never just going to hit this level of competence where it's like, I understand every culture, I can work with anybody from any culture, but just that we're constantly going to be learning about our unique cultural values, the differences that we have, and being able to honor other people's cultures and work with them. An example of a culturally competent service that I got to witness, which was really cool, was at the Center for Pacific Asian Families. They would use acupuncture circles as a way to bring women together to receive acupuncture as that like first service, but then they would get to talk about their experiences with violence at home, either with a partner or family member or another person. But having that acupuncture space was a way for them to bond over an element of their culture and kind of break the ice before they talked about something a little bit harder to talk about in a group setting. So that was an example of a culturally competent support or service I was able to see. But curious to hear from all of you. Do you feel like you or your loved ones have access to these kinds of services? Essentially services that are able to work with you and your unique cultural background. So I see no. Yeah, and if your answer is no, like what would you like to see available? And I think about Layla's response from earlier, like even having multilingual pamphlets and translations to these resources. I think that's an aspect of having culturally competent supports and services. Yeah.
I think maybe also, again, I've never explored this area, but having some therapists who also can deal with like family therapy, talking about like maybe intergenerational trauma, or parenting classes specifically catered to that, because with my job I can see a lot of like parents who they kind of transfer it onto their kids, like they're like, oh, this is the way that my parents raised me, so I'm going to raise my kids like this, and they didn't have like the time or space to examine like, oh, maybe this is not the best idea, maybe I'm hurting my kids by doing this.
So I'm kind of hearing, Layla, that like maybe you don't really have access to those right now in your community, and an example of what that could look like is having, yeah, like family therapy, especially around intergenerational trauma.
Yes, like I know what my condition is and how I deal with it. And I know sometimes why I do certain things that maybe other people think like perceive like negatively. Because I know my own condition, but I feel like even though my family does their best to understand me, like they're not like me. Like I spend a lot of time, researching it because I'm personally invested in it, but maybe they don't have that time. So having someone to explain and just say like, sometimes your child might do this, but you shouldn't react negatively because it's normal with their condition, something like that.
Thank you. Yeah, the answers here are looking a little bit, this makes me a little bit sad, but it's also, yeah, the reality, right? I'm seeing like, no, there's a horrible lack, none existent. Cultural competency needs to start from healthcare providers, even regular medical checkup, language access, interpreters barely utilized. Hmm. Okay, and Angelica, thanks for sharing this resource. Are you sharing this as an example of a culturally competent support and service, or is this the mobile mental unit team you're talking about? Okay. Yeah. Yeah, does anyone else want to add to this or expand on something they shared? All right, let's move on to the next question then. Okay. So this question is talking about our roles as family members, caregivers, advocates. If you've ever supported a loved one or another individual with a mental health condition, how does the support that you provide for them affect your own life?
I feel good that I can offer support and guidance and be helpful to someone else with a mental health challenge. It makes me feel very good and gives me purpose and meaning in my life.
Love that. Thank you, Sharon. Seeing others also sharing similar brings me fulfillment. Also seeing on the flip side, it's draining. It can be all consuming when I don't set boundaries for myself. It can be
It's all of those things. Yeah, it's incredibly fulfilling and incredibly exhausting.
Can we maybe expand a little bit on like when are the times where it feels fulfilling and when are the times it feels exhausting? And, you know, share whatever you're comfortable sharing, of course.
I would like to speak a little bit on when it sort of like brings me fulfillment.
Please, yeah.
Hi, I'm Kiona, by the way. So I sort of get I derive a lot of fulfillment when I help a loved one through like a mental health condition, because like as someone who has been on the other side of it, I know how like hard it can be to navigate, as well as like even like, you know, reach out to your loved ones. So like I can recognize that that's like a big step in itself. And like just like being able to, even if just like a, you know, simple conversation where they're just sort of, you know, telling me how they feel and like sort of ranting about something, I am just like happy to listen and like be that, you know, be that person for them that makes them feel seen and heard, because I feel like that's what most people, you know, that helps immensely, and that's what most people are missing from their lives. And just sort of like coming to the end of the conversation and them just being like, you know, thank you for just like listening to me and being here, holding that space for me. So that part like definitely brings me a lot of fulfillment. And I think it's also interesting how a lot of people said that like supporting a loved one can be frustrating, and it can sort of be like all consuming. I think that that is definitely like one of the downsides of like mental health conditions, is that it's definitely very sort of unpredictable, and it is, you know, it does go on a very like case by case basis. And I think that with that would be something that like mental health resources like in conjunction with like loved ones would really make a difference, in like helping someone feel supported. So it's not just like, you know, one or the other, or that they're separate, but like really they're working hand in hand.
Thank you, Kiona. Really appreciate that answer. And I think you're starting to touch on to like what would be helpful for those who feel like it's frustrating or draining. So for anyone who answered that, can you elaborate and yeah, share a little bit about what has been helpful or what would be helpful to support you as a caregiver or loved one?
Oh, go ahead, Gigi.
I think that the idea of being very, really, I think all this really comes down to the stigma, because like my son was in a very progressive school, progressive West Side, all of that, and still he had to lie and say he had a drug addiction and not a mental health crisis. And I think that for me, it was very hard to cut through that stigma. And I know people talk about it in other cultures, but it's in every culture, and it's just so endemic. And so as a caregiver, it's always feeling like, that you're going to be shunned, and it's really true, you are. And you don't ever, as Sharon says, you don't get a casserole. You don't get when you spent a week straight trying to take care of your kid, or not sleeping and on the phone all the time with hospitals and doctors, and getting nowhere fast. And so I just think maybe just to be acknowledged, as caregivers, and as caregivers to a very serious disease that people like I'm a support group. And we have mothers in New York that now come to our support group because they have children here. And I went yesterday and drove by a house where one mother in New York, her daughter thinks she is, and took photos of it. And just to tell her, it was a nice neighborhood. It was pretty bad neighborhood, but it was, but maybe her daughter's there, and, and just say, and just help, and just say, yeah, that must really, really be hard to be 3,000 miles away and not know, and just have some understanding that that people with mental health conditions have family members that are really struggling as well, or can struggle if they don't find support with each other, I think.
Yeah, what I'm hearing from what you're saying and seeing what some of these responses, it's important to have that sense of community, not being alone, having kind of like a team behind you, whether it's other caregivers or people who can relate with you. Yeah. All right, before we move on, just want to make sure I'm not moving on too quick. Was there anything anyone wanted to add? All right. All right, so this next question, especially, we're talking about 988 mobile crisis response teams. And we know that oftentimes in crisis situations, law enforcement can be the first go-to resource. Want to check in if you have a family member or loved one with a mental health condition that had an interaction with law enforcement during a crisis situation. And if you can elaborate on what that interaction looked like. Was it helpful, unhelpful? Did you feel safe, unsafe? Did you get linked to resources? Was it, yeah. So if you could be a little more specific in your responses, or unmute and share if you're comfortable doing so.
Well, it's not exactly a run-in with the law enforcement, but I will share that when I was really struggling with my mental health in 9th and 10th grade, I went to see my therapist, and I have the cheapest medical insurance, but I still have medical insurance, so I'm very grateful. But this therapist, she when I stopped going to school, because I would just, every time I would try to step into the school campus, I would just have like a mental breakdown and just like completely break down in my car, have a panic attack, like I couldn't get myself to go in. whenever I would tell my therapist that, she would be like, well, I don't know what to tell you, but you have to go to school. And then when I was like, I don't think I can, like, I don't think you understand. I physically can't step into the campus without, breaking down. And then she would threaten to send the law enforcement to my house or threaten to call the police on me or she would like try to guilt me into it by saying that my entire family would all be arrested if I didn't go to school. So obviously that did not help at all. And I just continued to not go to school, and I just moved into homeschool, which thankfully they had that resource. But yeah, I don't think the law enforcement should really have any place in mental health as it currently is, because it just escalates the situation instead of de-escalating it, because I don't think law enforcement officers are trained to de-escalate situations without violence or force.
I'm so sorry that you had that experience, Layla. In high school, I had very similar experience. And they actually did send law enforcement to make me go to school. And when my parents didn't know what to do one day when I was in mental health crisis, they called 911. I was handcuffed by 5 policemen, like pushed down on my bed and handcuffed when I was just like standing there. Very unnecessary. So yeah, I had a very similar experience with you. And especially it's interesting how the school as an institution kind of, is bringing in law enforcement.
Yeah, I think that they just make you feel like a criminal when you haven't done anything wrong. Like having a mental condition is not a crime. And it's just like the way that they're like, oh, like you're not going to school, you're not like functioning as a normal person, so we're gonna arrest you. And also the fact that most schools have police officers just standing around, I feel like that is very unhelpful as well. That just creates an atmosphere of just fear and tension, and does not encourage people to seek out help or to speak their opinions or their mind, because they're just always there, like yeah.
It's so sad that they don't make space in their consciousness for people with brain issues and mental health conditions. Why don't the school administrators make space for the two of you? I mean, the cops are so unnecessary. So you don't want to go to school for a while. You want to stay home and protect yourself. They should allow you to stay home and protect yourself and take care of yourself. I'm so sorry that happened to the two of you. It sounds terrorizing.
I want to shift real quick, and this will be the last one, but someone mentioned there's a special crisis team that was helpful. Do you mind sharing a little bit about that? I want to make sure we include different perspectives.
Okay, hello. I'm a emergency department nurse, and we oftentimes receive this case patient, a person with a mental health crisis, and the hands-off from the West Hollywood sheriff team was excellent, and it was so helpful to keep everyone safe, including patient himself, who was fearful of everything, and there was no threat in any way. There was a social worker, I don't know, it was a case manager, I don't know the title exactly, but he specializes in youth care, youth mental health. So he already established good rapport with the patient, and yeah, I felt safe as a staff, and patient was cooperative. I mean, it's still agitated but manageable, and the family member felt safe that their son is in a good hands. So there was no officer, so to speak, but I know they came from sheriff. That's what they told me, and they was 72-hour hold was already placed prior to emergency department. I appreciate that. I hope that they did not cut the budget on that service. Thank you for letting me share.
Of course, thank you so much. Elizabeth, was there something you want to share real quick?
Sure, I'd love to just jump in and say that is such a great story to hear, just being on staff at City of West Hollywood. The city has invested with the sheriffs in a MET team, mental evaluation team. So we have the capacity within our first responders to send out a specially trained deputy who rides with a Department of Mental Health clinician, and then they're able to work their magic. And really that deputy sheriff they call themselves the SWAT team for mental health. So they have that level of crisis training, but it's specifically for intervening to de-escalate and keep everybody safe in partnership with their clinician partner. So the team's been really effective, and so awesome to just hear that story from you, and that the experience went well.
And just a quick follow-up question. Do we know if there's like peers on these teams, peer support specialists? I'm curious about that.
Specifically, the MET program is a partnership with LA Sheriff's Department. They don't have a peer component to that yet, but I will shout out that the Department of Mental Health is I alluded to it earlier in the care team presentation, but they currently are doing